So when is cutting Suboxone ever needed? Well, first off, please don't tamper with your medications without talking it over with your provider. Now, there are a few scenarios when you may need to cut up your Suboxone. Let's go through them together. 1. If you're just starting Suboxone, sometimes when you need to figure out your initial dose, you need to take small amounts every couple hours depending on what your provider recommends. For example, sometimes I tell my new patients to take 2 milligrams of Suboxone every 2 hours, but since they only have 8 milligram strips, they have to cut them into quarters. 2. Some patients notice that their cravings and withdrawal symptoms are better managed if they split up their Suboxone dosing throughout the day. In these cases, your provider might suggest cutting your Suboxone in half or into quarters and taking them throughout the day. An example of this would be taking 4 milligrams of Suboxone every 8 hours for a total dose of 12 milligrams daily. I'd also add that the analgesic effect, i.e. the pain relieving effect of Suboxone, tends to be better if it's dosed more frequently as well. So in the case of chronic pain, your provider might suggest cutting up your Suboxone. 3. When someone feels stable in their recovery and they're ready to start tapering off their Suboxone, we often start using smaller and smaller amounts of it. Depending on how fast or slow you and your provider decide to taper, you might be dropping down a fraction of a strip every couple of weeks or so. In these cases, you'd also be cutting up your Suboxone. Another question I get a lot is it even okay to cut up Suboxone? Well, the official FDA package insert for Suboxone says not to cut strips or tablets. The reason is likely because the medication might not be evenly distributed throughout the strip or tablet. But one research study and the collective experience of most patients and providers shows that it's probably okay to cut or split them. So let's go back to that one study. It came out in 2019, and the researchers looked at different cutting methods, the uniformity of buprenorphine in the film, and the stability of a cut film over time. The 4 cutting methods were with a razor, with scissors, folding and ripping, and folding and cutting with scissors. Then they looked at the amount of buprenorphine when the films are cut, and they looked at how stable the buprenorphine was after 7 days. They concluded that all 4 cutting methods led to an acceptable variation in weight of the film and uniformity of medication when the film was cut in half, but not in quarters. That means splitting Suboxone in half is fine. Splitting Suboxone into quarters might lead to some inconsistent dosing. They also found that using a razor was the most accurate. It also showed that after cutting the films and letting it sit at room temperature for 7 days, the Suboxone strips that were cut in half were still good. The buprenorphine levels were acceptable. So overall, one research study showed that cutting Suboxone strips in half is fine and using a razor is most accurate. Cutting the strips in quarters might be less accurate. The study did not look at tablets, but in my clinical experience, splitting tablets also works, but it might be a little harder because they tend to crumble and disintegrate. And of course, talk to your Suboxone prescriber or pharmacist if you have any more questions or concerns.